Well, for some reaction, we can bring in Cédric Hansen, a physician specializing in geriatric care who holds a number of leadership positions, including at a French nursing home and as part of the International Commission on Disaster Medicine. Good morning, and thank you so much for speaking with us at what I imagine must be a busy time for you.
Yes, it is, because most of the elderly are suffering from that heat wave. I would like to have the opportunity to explain two important things. Heat wave damage your body by two ways. One is dehydration, but the other one is by drilling or by eliciting an inflammatory response, a huge inflammatory response inside your body. And this is the cause of death from the people you just mentioned that there were so many deaths during heat waves. The deaths occur because we have a storm inside our body that increases the body temperature, which is drilled or elicited by the outside high temperature. And if you're exposed more than 8 hours to a high level of temperatures, then you have multiple organ damage, and that causes the death. So it is very important to be able to escape from the heat every second moment, like every 2 hours, to have a 10 or 20 minutes relief of the heat wave. And that's why you need to have not constant cooling system, but to be able to access to a cooled room. There you can rest your body against the heat wave. And that is very important.
Yeah, I want to ask you more about the impact on our health, but first I want to get your reaction to the report that we just saw. Can you tell us what are your thoughts on France's preparedness and management of what has been a historic heat wave?
Well, in terms of management, it's always so easy to complain backwards. But what is important is the way we built hospitals and homes. Is we do not include in the specifications, we don't include the fact that the buildings should have important cooling systems. What we have also is a lack of understanding by the teams that it is important to open the windows when it is colder outside than inside, and to close the windows when it's the heat is more important outside than inside. For example, where I work, we have a cooling system, not a cooling system that is supposed to warrant 21 degrees inside the building, inside the facility, whatever is the temperature outside. But the windows are remained open too long. And because of that, the cooling system cannot control the heat inside the facility. So there is a change of habits. We need a drift of knowledge and know-how from the entire population that need to adapt itself to the heat waves. So it's not only a question of governmental preparedness plans, it's also a question of incorporating the culture of facing heat waves. There's many countries in the world where such temperatures are normal, even in winter. So if you are in sub-Saharan countries, or in Arabic Peninsula, or in India or North America, in some part of North America, those temperatures are normal, and people know how to react to them, how to adapt, and even their body is accustomed to such heat waves. So there is a sociological adaptation that is needed in the coming years.
Perhaps bodies could adapt. That's sort of another topic. But when you say that all it takes is changes in how we're reacting, I mean, I can say for myself, and I think many people in France, we close everything down the second it gets warmer outside than inside. We open things up at night. Still, in my apartment, it's been over 30 degrees for the past couple of days. I mean, is that really sufficient? It's hard to believe.
The point is, we can't change the temperature outside. It's like saying to someone who has fever, stop having fever. We can't say to the to the planet or to our environment stop to be hot. So we have to adapt to the fact that we are facing this heat wave. The point is we can sustain such a heat wave if we have the ability to like every night or every second hour or in different periods, we can spend 20 minutes to half an hour in a cooled environment. So what is the most important is not to be facing heat, is to have the ability to not to sustain heat all the time. And what is important in this heat wave is not the level of the temperature. The most important thing is that we need to have our body to rest and to be able to recover from fighting against the heat. It's like running a marathon. You can't run a marathon 3 times a day, every day. And that's what we are doing because we don't have we don't take enough shower during the day to cool down our temperature, for example, or we don't have access to cooling systems. But that's a change in our habit. It's not to work, not to go outside when it's too hot and things like that. But being exposed to 30 degrees for many days and night, that is something that we are going to be forced to adapt because this is going to be the norm in the coming years.
Yeah, I mean, as you say, it would require sort of structural changes in society for us to be able to take those breaks constantly throughout the day. I know in care homes, for example, after that deadly 2003 heat wave, it was obligatory for them to have at least one air-conditioned room for residents to take those breaks. But when we're talking about elderly people, I mean, is it really realistic that they're going to be constantly going back and forth to a cold room, especially, you imagine overnight? I mean, they're going to have to be sleeping in very, very hot rooms. Is that something that's reasonable and safe for people of that age?
Yeah, of course, there is many issues regarding this, but in disaster medicine, you are accustomed to do with what you have and not calling for what you would expect because you will never get it. So right now, we should change our way to the way we build, the way we conceive homes, the way we conceive hospitals, and we are facing a paradox because our government asks us to decrease the consumption of energy. And in the same time, we see that we need to increase the use of energy in order to cool to have systems that will decrease the heat. And this is a huge paradox. And we have to find new ideas in order to do that. But back to your question, of course, it is not satisfactory to have elderly people in a home that are drive from their room to the cooling room and then back to their hot where they have the bed. So of course, this is something that is shocking to some extent, and it is difficult to admit. But the question right now, today, is how to save the lives, because there is people dying from the heat wave, and we don't want the elderly and we don't want the young people to die from that. But the most stroke population right now is it's the youth. It's from 18 to 44 that pay the more toll on that heat wave rather than the elderly. So that means the system we have is not saving, but is actually protecting the elderly and the frailty ones more efficiently than the young people.
Yeah, young people who might overestimate their capacities to deal with things. Authorities have said that we are clearly going to see an increase in mortality due to this heat wave, but they haven't given any figures yet. In your sense at this point, how high do you think that number is going to go? I mean, is it going to get anywhere close to those 15,000 deaths that we saw back in 2003?
I can't forecast that, but what we have to understand, each of us, is that a heat wave doesn't kill during the heat wave, but the effect of the heat wave and the death toll and the increase of disease, of illnesses, will continue over the next months and sometimes over the next 2 months after the heat wave. And during that period, you, me, everybody is at risk of developing some damage that may threaten our lives. And it's not to make everybody to be anxious about it, because it's just like using a car. It's dangerous to drive. It's the most dangerous way of moving around. But nobody think about it. But it is dangerous to drive. Well, it is dangerous to be exposed to a heat wave, and some people will suffer from that, and not only during the heat wave, but and we have to take into account the death and the illnesses that are coming in the next following weeks, because there we will get an increase as well as right now that we are suffering.
A good reminder to be vigilant even as the temperatures go down. Cédric Hansen, thank you again so much for speaking to us. Very interesting to get your perspective and somewhat of a reality check on the situation. That's Cédric Hansen, a physician and vice president of the International Commission on Disaster Medicine.